Imagine living with a treatable disease, but you cannot get the care you need. For millions of men, women, and children suffering from lymphedema, this is their daily reality. And yet, a necessary, effective, and proven treatment option is not covered by Medicare, adversely affecting the health of many. So what is lymphedema? Lymphedema is a chronic disease that results in the accumulation of protein-rich lymph fluid in parts of the body where lymph nodes or lymphatic vessels are damaged or inadequate. Although some children are born with it, the majority of cases are caused by cancer treatments that can damage the body's lymph transport and immune functions. In fact, among the 2.9 million breast cancer survivors in the United States, between 20 and 40% have developed lymphedema. When lymphedema is left untreated, it puts patients at risk for serious infections and other costly and debilitating complications, which lead to higher costs to patients and insurers. Compression garments reduce the dangerous accumulation of lymph, forming an essential component of care. Unfortunately, they are currently denied Medicare coverage due to the lack of a durable medical equipment benefit category, or DME. This is like breaking your leg and being told to keep it in alignment so it will heal properly, but being denied a cast or crutches because of the technicality that there is no DME benefit category under which they can be covered by Medicare. The Lymphedema Treatment Act will provide an easy change in the law to legally establish a DME benefit category that will enable medically prescribed compression garments, multi-layer bandages, devices, and supplies to be covered by Medicare. This grassroots-driven bill will reduce total health care costs associated with this disease by decreasing the incidence of complications, comorbidities, and disabilities.
There is a clear path to at least help. We know this bill is the right thing to do. We know it's the right solution. Medicare should reimburse for compression garments for people who have lymphedema. We're going to work to get everybody, 100% of our delegation signed up. We're going to continue to get other supporters. I know we're going to get it done.
I support the Lymphedema Treatment Act because as a physician, I work with a lot of patients who have lymphedema, and I know how devastating it is to their lives.
I was misdiagnosed for close to 45 years.
It's affected me since I was 12 years old when I first started having the symptoms.
It's an everyday thing to live with.
I believe that the garment is the key to lymphedema management.
They're actually made to where every time you flex your muscle and move, it acts like a massage and moves it out of your body into the center core of your body. If I didn't have these on right now, my calves would be almost the size of my thighs.
There are so many people, including myself, that cannot afford to pay for these garments.
Without the Lymphedema Act, the people who would need these garments can't afford to get them.
I not only support the Lymphedema Treatment Act, but I'm the author of that piece of legislation. The first thing I think about is the pain and the suffering that the people are going through.
You can see it already starting to open up, and this is supposed to hold that in.
Your health should not be dependent on whether you can afford to buy a garment that will make you feel better.
It's the one thing you cannot do without. It's not optional treatment. It's absolutely necessary to be able to function.
To me, it seems like it's a common sense, logical solution. The power of the people, the voice of the people really makes a difference.
God bless America.
I support it with all of my heart because no one would help me for 20 years. And when I found out that there was a bill that's going before Congress and that there's a chance for all the people that have suffered for many years, myself included, I'm right there and willing to support it any way I can.
You can make a difference and effect needed change for millions of lymphedema patients simply by supporting the Lymphedema Treatment Act, which will supply the missing benefit category. We know that you care about quality health care. This is an easy way to improve health care for millions of Americans while reducing costs.
I support the LTA.
I support the LTA.
I support the LTA.
I support the LTA.
I support the LTA. Please join us.
Join us.
Join us.
Join us.
I support the LTA.
I support the LTA. Join us.
Please join us. Help support the LTA today. For more information, visit lymphedema treatment act.org.